Welcome to Veterans Counseling Veterans podcast. It's called Veteran Suicide, the Local Solution. How you guys out there, Facebook fans, Veterans Counseling Veterans Facebook fan? I know you guys missed me. I know I was on last week. I know you missed my pretty face, but I'm back. All right. I tell you one thing, I got to get a great shout out for Jean Gautreau. She did a great job. And I just want to, you may see a familiar face here. You just saw last week, you got Dr. Kinsler here. But anyway, we're back and it's time to have some fun. June is considered the National PTSD Awareness Month. And one of the things that I feel, especially Veterans Counseling Veterans, that we don't spend enough energy and time on the family. And the family is still a part of the veteran community. And so what we try to do at Veterans Counseling Veterans, we also want to find out what's going on with them. And I tell you, if you look at some of the statistics, and some of you guys don't know that, there over almost 60% of the veterans have a family. And then if you count, and that's married, then if you count who a single parent, that's 20%. So we almost have 80% of veterans out there with families, but what are the services that are provided to them? So I wanted this particular podcast to get some insight by inviting three families, all with different demographics. And when I mean demographics, I mean that we have one that's active duty, we have one that's single parent, we have one that's also married. But first of all, before I do that, I want to sit there and introduce the clinicians. So what we have here for us clinician is we have Dr. Carlos Garcia, who's Veterans Counseling Veterans Tribe. How you doing, Dr. Garcia?
Good, Tony. Good to see you again, man. Glad to be here today with this important discussion.
Great. Great to have you on there. Dr. Michael Mays. How you doing there, Doc?
Doing well. Glad to be here. Glad that you invited me.
Thank you. I'm glad you accepted. And also we have Dr. Kimberly Kinsler. How you doing there, Doc?
I'm good. Thank you for having me back. I'm excited to be a part of it.
I'm glad you accepted as well. So what do we want to, and the families that are here right now, we have Lakeisha Houston, who's actually from Veterans Council and Veteran Tribe. Normally she's on the left-hand side of the slide, but in this case here, she's on the right-hand side. But we got Lakeisha Houston, who's also active duty, and she's a big-time advocate for MST, PTSD, and suicide. So I definitely have to have her. We get that special insight on what it looks like an active duty with her raising her son. And we have Tiffany Davis, and Tiffany's been here before on our MST side. Tiffany is a single parent raising two beautiful kids, and going through with MST and PTSD. But I want to once we have our conversation with the docs here, I want to know more about the families that we're talking about here. So let's talk to the docs and while we get a chance before we start introducing the rest of the families. So docs, PTSD and families. What is your take on that, Dr. Kinsler, about PTSD and families?
When the patient experiences something, in this case, the veteran, when the veteran experiences it, the family experiences it as well, because they have to watch them and deal with the aftermath. So if someone has to go to the hospital, it's the family that's got to take them there. If someone's incapacitated for a time period, then the family has to pick up the pieces and, if there are kids involved, explain to the kids what's going on with mom or dad, or why are they not here in the case of inpatient treatment. So the family experiences it too, even though we don't always acknowledge the family. They suffer just as much as the patient.
And Dr. Mays, what are some of the things you've seen when it comes to when you see a child or even maybe not even a minor? What are some things you see as far as the veteran, the PTSD?
Well, what I've come in contact with especially working with a veteran, is that the family is traumatized. They become traumatized and they have a hard time. And then sometimes they're not sure, is this really is the veteran really that bad off, or are they just acting? They're not sure. And so the mindset kind of becomes very difficult. And then if you have a wife who's trying to take care of a husband and then trying to take care of kids, and the kids are reacting, having a difficult time. So the whole, as Dr. Kinsler said, the whole family is just interrupted and affected by what's going on with this one person. And then you have, when you start getting into chronic care, where it's that long term, the disability is not for a month, for a week, like you have a broke arm for 6 weeks. Now you're talking about the rest of the life. So wow, it's just a constant thing.
And one thing I forgot to add, and which is, I think, like the most important thing to add. All the doctors here are veterans, and so they had that special insight. Now, Dr. Mays, you retired from the military, so you've seen the whole from beginning to end and stuff like that. So you understand that whole gambit of that there. So I want to make so when Dr. Mays talks, and so everybody here talks, they're talking from the experience of living that veteran life, which I think is very important. Carlos is a single guy here, so but still, he has lots of patience, stuff like that going on. So it's Carlos. What is your intake? What do you see about the veteran PTSD and the families?
Yeah,
that's on your side.
Don't let my girlfriend hear you say that, Tony. We're going to be, one of the things that I like to share is that, and this is, more so kind of for the layperson, but that oftentimes we think about PTSD and we have this vision of these chronic symptoms, the hypervigilance, the nightmares, the flashbacks, but it doesn't always look like that. There's a lot of folks that suffer from PTSD symptoms that may not even meet the actual threshold for a clinical diagnosis, but it doesn't mean it's not impacting both them and the family. We can look at sort of rates of something like marital discord, or even a mother or father who's just emotionally disconnected from the children because they're dealing with their own sort of internal stuff. Increases in substance use, alcohol use, increase in divorce, some of those other things that can also exist and have a root cause of PTSD that we need to be on the lookout for.
Can I add something really quick, Tony?
Yes, sir.
Dr. Garcia, he mentioned something about symptoms, and that was something that I'm really glad you brought that out, because you can actually have symptoms and be subclinical. And so thank you for that, because a lot of times, I'm prior Army, and I'll leave it at that. But I know that sometimes individuals, and not just in the military, but it could be trauma from a natural disaster. Sometimes they have symptoms of PTSD, but they don't meet the threshold of that clinical diagnosis. So thank you for pointing that out.
And you'll hear some of the ladies talk about how it's a big difference between when you're diagnosed and when you've had it, and there's a whole big gap there. Sometimes it could be a year or two before you find diagnosed. Mm-hmm. So and I really appreciate that. And we're going to come back. What I'd like you guys to do is sit back and you listen. And then bring in, as we talk to some of these ladies and find out what they're going through, if you have any kind of comments, really appreciate it. So first, I want to bring on Lakidra. Like I said, Lakidra is in active duty. She's in Texas. She has a son, and so she's suffering PTSD as well as MST. So how you doing, Lakidra? Welcome to this podcast again.
You're on mute.
There you go. Oh.
Can you hear me?
Yeah, we got you. Go ahead.
All right. I'm doing good. How's everybody else doing?
You're doing okay.
Good. So as Tony mentioned, active duty with PTSD, I struggled for a long time. I didn't understand what the meaning of PTSD was. I honestly thought that it was, you have to have the flashbacks of events that happened. You had to have suicidal, these tendencies to be diagnosed with PTSD. So when we first were informed of PTSD, I thought it was something that I couldn't have because we were informed as active duty members. It was more so, you had to be in a deployment situation to have, PTSD to be diagnosed. So I never understood PTSD until probably close to 10 years to my incident that happened. But the way it affected my family was after an MST situation. It affected my family because I started lashing out at my son and not understanding, hey, maybe this is some of the triggers that I have. Lashing out, I was very distant with my son. I didn't know how to mother him. It was just like I gave birth and then I was just distant. And at first it was more like they were saying that postpartum depression, but I don't think that's what it was. It was a lot. I started lashing out at my husband at the time. I was being really irritable at work. I was doing all these things that I didn't understand what PTSD does. So when we talk about how it affects our family, currently, me and my son do not have a good relationship, and he's 15 years old because of not understanding myself and not getting the treatment I was supposed to get as an active duty member. I did not get any treatment. I found out later, probably 5 years ago, and they were like, well, your symptoms and everything, or I won't say symptoms because we really didn't understand everything back, at that moment, but they were like, it seems like you have PTSD. But I never understood, it in the beginning. And I could have got help in the beginning if somebody active duty would have told me. And if I would have said something in the beginning, I thought that I would get kicked out the military. So I never shared it with anybody. I was just having these issues at home. I was dealing with abuse at home. I had a sexual trauma that happened. So all these things had happened to me and I never understood. So like I tell everybody, you have to really sit back and understand what PTSD is. It's not something that you should be ashamed of. And I think that was with me. I was ashamed of it. I was like, well, maybe I'm just crazy, because that's the mindset we have. We're crazy. We don't understand it. But I think a lot of people should go out. They should research and understand what it means. It's okay if you don't get help active duty side, because it's hard for us to find help on the active duty side. So a lot of us have to go out and find it through the civilian side. So I would caution everybody, don't give up, go find help outside of the active duty side. So, and make sure your children, my son has to go through therapy because my anger lashed out on him, and he was going to school kicking students, kicking teachers, spitting on people because I was so angry for no reason. I didn't know what I was doing to him. And then it just kind of trickled on. So now he's, getting support he needs. I'm getting the support I need, but it's sad that, as an active duty member, we don't discuss PTSD. We just kind of, if you do it, you say something, you're going to get kicked out and you're probably crazy, so.
Who do you get your sources from? Is it Military One Source? Who do you use on since you're active duty?
I just do Military One Source. I don't have anybody that I really go to. I mean, we mentioned this before at the MST podcast. We don't have anybody. We just kind of, find somebody and hopefully somebody will work.
Really?
But that's it. Yeah. I don't hear, it's not given to us. Now I heard about a program called DAVA that came out about domestic violence, stuff like that, but we are not informed of this. We don't know. Certainly as a cop, I didn't know anything.
Oh yeah, that's right. You're a cop in the Air Force, right?
Mm-hmm.
Yeah.
You said something, and I just think it's a tragedy that what you're saying, I have heard, and I have actually seen people come to our office and say, I'm not gonna use, maybe I have TRICARE, which is, for military. I am not going to use this because I don't want anyone to know. I will pay out of pocket because I need help. But if they find out I'm getting help, they're gonna kick me out.
Correct.
And it's almost like doing lip service. And this is my soapbox, I'm sorry. It's like doing lip service to treating veterans for PTSD, because you're really not treating them, you're punishing them by kicking them out and firing them from their job.
Mm-hmm.
Hey, Dr. Mays, because you retired in the Air Force, right? Have you seen the same kind of thing? What's been your experience? Let me get you into.
You're Dr. Mays, you're muted.
Okay,
so I think I've seen exactly the same thing. And I believe what has to do is it's a lot of education, because what I do when I have, because I also am did you hear me?
Yeah, I can hear you.
Okay. I'm also a TRICARE provider. And so I get TRICARE clients, which is mostly your spouses, your kids, your family members, and then Military One Source. I provide for Military One Source. And then, of course, just out of network. And so I get a lot of clients who come in for that, a lot of veterans who have come and they don't want to go see a counselor because that idea of I'm going to get in trouble. And so I try to educate them that the only time that your command is going to learn anything, the possibility of them learning anything when you're going to, especially Military One Source, whatever, is if you are being forced to go.
Now, let me just throw this in then. There is, when you use insurance, because we accept other insurances, there is a national database. Everything is codes and numbers. And there is a database. it doesn't say, it doesn't have all your information that that might be contained in the clinician's note, but everything is done with code. So there's a number assigned, your social or something, or member ID, and then there's a number what you came in for. There's a number what you're being treated for. That's all. It's all there. And if you have a security clearance, depending on how high it is, one of the questions they're going to ask you is if you've ever sought mental health treatment. And you can't lie. And there goes there goes your job potentially. So it's really unfortunate.
And that's true. That is true. So you don't want to lie, but I have seen the same exact thing that has come in. And again, I still believe that a lot of this also is just helping to educate the member about what their options are. But you're right. If the people want you, and when you go in for a top security clearance and you have to report, better to tell the truth than to not. And so, yes, there is that challenge that you look at. However, from what I've understood, because I still have connections with some people, and of course, Tony, they are working a little bit more diligently at trying not to hold it against you for going to counseling on your own. If you're, so that's a different story.
And I don't really want to get too far away from the family, but I do want to say is that I was military intelligence when I was in the military, and I was company commander. I want to know if you're stable or not. I'm gonna tell you right now. So I don't care what you say. I need to know if you're going to be a danger to the mission, to the soldiers and the airmen, whatever we're going to talk about it. So that's what people seem to forget, that you're in a military unit where I'm responsible for everybody's welfare in the mission. So if I don't know, that's like setting me up as like, might as well give me a grenade. Here's a grenade, Tony, and I don't even know who has it. So that's the difficulty, but it's not this show, but the show about the kids. But though, yes, that to me it's a lot more difficult than people think when it comes to job security and mental health, and it's a lot more other things to think about. But I appreciate you bringing it up, and maybe we'll have a show on the next time about that. So next, the next one I want to bring up is I want to talk about talk to Tiffany. Tiffany is retired Army. She has, PTSD, MST. She has a daughter, 16-year-old daughter, and you have how old is your son, Tiffany?
He's 3, and you may hear him in the background screaming.
Okay, yep. Well, don't worry, I'm a father, so that's what filters out. I don't hear anything. My wife be saying, "Don't you hear him? Don't you hear him?" I say, "Hear what? I don't hear anything." But anyway, one thing I do want to mention before I hit to Tiffany is that I want whoever's watching this podcast, I want you to know this, okay? Tiffany, tell me to do this. I'm gonna do this anyway. Tiffany has been trying to find out what the heck is going on with her dang unemployment. I want to know what's her thing. She put in for it way in February, and God darn it, it's like June. What's going on? Okay. So anybody out there on this podcast, this is a veteran, combat veteran, single parent with 2 kids. Give her dang check. Okay, now we get off the soapbox. Okay, Tiffany, go ahead. Tell us what's going on. And is your daughter going to join us?
Yeah, she's going to join briefly, only because the is a little loud.
Okay, just briefly. Okay.
Yeah, she'll join. When Lakedra was talking, I kind of feel her pain because I went through the same thing. I was deployed in 2004, 2005, sexually assaulted and kind of hid it from the world over the years. I didn't really come out and tell nobody until I think probably 2012 when my grandfather had passed away. And I kind of came out and told everyone. 2014, I was picked up for AGR, which is what I was doing when I medically retired. And through that time, I was in a very toxic relationship, going through all types of things with him that was kind of not that good and triggered me in every way you can possibly think. While on active duty, I didn't know any way to get help because as soon as you tell somebody that, hey, I'm going to kill myself, or, hey, I cut myself or anything like that, they kind of, we're like, okay, well, let's send you to the hospital. Let's get you processed out. So I definitely understand that. It wasn't until I went actually to an LHI appointment, kind of got tired of lying, got tired of hiding. And I decided to come out and tell them that, hey, I got anxiety, bad, really bad. Like having attacks, chest hurting, all type of stuff. Over the years, I found myself not only having the nightmares, the flashbacks, hallucinations, I'm paranoid, and everything else, but I have an anger problem. I have a serious anger problem. Right now, it's I'm sorry, my daughter just said yes. So it's right now, it's kind of hard actually for me to get any help with anger management. I was told I would be able to go to anger management at the VA here in Orlando, Florida. One thing that my therapist didn't know was the lady that called me, another lady called me to schedule my anger management appointment and with a group. My therapist immediately called me probably like an hour or two later to tell me that I was the only female that would be in this anger management class. Now, I already told you my background, my issues and everything else. I don't think it would be good for this female to be sitting in a room full of men being angry in Florida. So I, of course, told my therapist, who I'm actually grateful to have, that I wasn't going. And she can call that lady and tell her I wasn't going. So it is very hard to get help. And what really kind of upsets me is that, my daughter she's had to go through a lot. She doesn't want any counseling or anything like that. But she says she's fine. She's actually a very level-headed young lady, surprisingly, even though, she's actually seen me attempt suicide on several occasions. And, kind of gets a little bit of anger. I've calmed down a lot, though. And I'll just let her tell you briefly about my anger problems quickly so she can contain the the guy over here. But this is Christiana.
Christiana, how you doing? How you doing, Christiana? Just tell her all the dirt. Just tell us all the dirt, okay? We ain't gonna tell nobody. Everybody's just go ahead.
Living with my mom, we did move around a lot, and I have noticed over the years that she does have anger issues. It's just like in the small things, like when she can't find something, she'll get really mad that she can't find it, or like she tries to rush out the door because she's late, and then she gets really bad road rage because she has to be where she needs to be and she can't get there in time. And sometimes it can get really bad, and like she'll get mad at like a really small thing, like she dropped something and it broke, and then she'll angrily clean it up, and then she'll be in a bad mood for the next hour. It's just that during those times, usually I would take CJ because she just needs some time to cool off, and it's not bad living with her. I'm grateful to be living with her, but like sometimes I wish she was a little less angry. It's all good.
Thank you. Really appreciate you being that. Hey, docs. I know I'm paying you nothing, but what's your advice with the Tiffany situation? We'll start with Dr. Mays.
I think, and Dr. Garcia, you're muted, just so you know.
Oh,
there
there
we
we go.
Go ahead. I'm sorry.
Well, I was just going to jump in real quickly because I've done a lot of anger management and used to do some anger management groups. And we look at an emotion like anger, and we have this very negative sort of reaction to it, right? But what we need to remember is anger is one of the easiest emotions to have, right? Or more socially acceptable, believe it or not. Not depression, not being sad, not being worried. But if we're upset, that's okay. And depending on sort of the culture that we come from, I mean, if we think about it, I know at least I heard this more than once growing up as a child was, suck it up. Don't be sad, don't be angry, or why are you feeling this way, or why are you feeling that way? Stop crying. And so I think we learn from a very early age that sort of negative emotions aren't okay. And we spend a lifetime of, life coming at us. experiencing negative emotions, experiencing distress, experiencing, bad things happen to us, but we don't talk to anybody about it. We don't process it. We don't do anything with those emotions other than just jam them in there. And so year after year, time after time of these, things happening to us in life. And I tell my patients, it's like a pressure cooker, right? And so when we're responding to small things with a lot of anger, chances are that it's not that incident. Chances are that there's so much stuff bottled up inside that we're already redlining it when it comes to that reaction. Yeah. And so a part of it is we're just trying to be so resilient, right? We deal with some sort of trauma, we're dealing with family issues, and we're trying to be strong. We're trying to be resilient for those people around us. We're trying to be resilient for our partners, our children. And it's almost like, well, I don't have time or the space to allow myself to process some of these negative emotions. And so we bottle them up. And I think all of that bottling up eventually leads to, someone cutting us off or dropping something or some little thing happening, and we feel like we're completely losing it. The saddest part about that for me is that then we blame or we judge ourselves for having had that reaction when I think it's absolutely natural.
Dr. Mays?
Yeah, I mean, of course.
Talk to the child too. I want to hear some talking to the child a little bit as well. Go ahead.
Well, I mean, just like Dr. Garcia was saying, we got to first understand where this is coming from. We're bottling up emotion, so we want to let the emotion out. We don't want to hold that emotion in for any long period of time. But when we don't understand why we are, so it's a brain thing, right? So if you have PTSD, we know that there's some type of trauma that happened to the brain, and we think that trauma has not gotten to a place of where we could connect the emotion to the reasoning center, right? So if I see something that happens, we do it a lot. I don't know if you've heard of what we use called ART, Accelerated Resolution Therapy, which allows you to reconnect the reasoning center. I see something, and so this thing keeps reoccurring because I haven't really processed through it. As Dr. saying, you got to process through that thing because it was an emotion. I got caught in the emotion, and I keep reliving that emotion. So I have to try and get to that. But
I don't mean to cut you off or anything, Doctor. Is that kind of similar to the CPT therapy?
No, it's more like EMDR. Kind of like that.
Yeah, it's more like EMDR. Yeah.
More along that line. But it's accelerated. It's a short-term type of therapy where we can get to the challenge much quicker. If you can look it up, Accelerated Resolution Therapy. You can go online. You can look it up. As a matter of fact, have you heard of the Camaraderie Foundation?
No, I learned
There's an organization called the Camaraderie Foundation. They have a base right there in Orlando, and you can get some help through them, and they can get a counselor for you who can actually work with you in that area. Now, for the daughter, it's just challenging. You're talking about a child who can't control the situation because mom is in control. Mom is the one who runs the home and everything like that. So, already from what I'm saying, the daughter is one step up because she recognizes, hey, I got a good mom. My mom loves me. My mom cares about me. And so these basic outbursts or challenges that she's facing are she's working on them. And so that's a good positive for the daughter. Her having outlets is important. She needs to have an outlet, someone that she can go to, someone that she can talk to. Talk therapy is a big helper, is letting that emotion out, talking to someone to let it out. I was actually on a Wounded Warrior retreat. I don't know if you all have done the Wounded Warrior retreats that they used to have, Odyssey and different things like that. If you have never done that, that's something else to look in with the Wounded Warrior Project. But a young man said that he couldn't talk to anyone because they wouldn't understand. He couldn't talk to his wife. He couldn't talk. And that's where it happens. When you're not talking to someone, you're not opening and letting it out, then that becomes a challenge. And so for your daughter, it's about talking to someone. The challenge is, who do you talk to?
Yeah, and I think that's one of my main issues. And I'm in CPT right now. Is it helping? I have no idea. Is it intense? Yes. My issue is trust. I don't trust nobody. You know.
Yep.
I don't know.
Dr. Kinsler. Yeah, go ahead. In fact, both of you, because Lakeisha has a 15-year-old son who she's kind of disconnected from, and then of course Tiffany has a 16-year-old daughter. Can you talk to them about just
so even if I would say honestly, you definitely want to continue your own therapy, but I will say this because hope is important. Okay, PTSD is treatable. It is not a life sentence. Even if it feels like it is not a life sentence. You can actually learn to cope with this, learn to cope with the feelings, and you can actually have a wonderful life. You can go on to have a wonderful life. This does not have to define you for the rest of your life. That's the first thing. But with the kids, sometimes we see, particularly if you mentioned that your daughter has seen you attempt suicide. That's a lot. And if there's been lashing out, if there's been anger, sometimes kids have their own stuff that they're dealing with. I mean, we all have our own stuff, quite frankly. But even if the child doesn't want to go to therapy, they do need some other person. Someone mentioned having an outlet, some other trusted adult figure, whether it's an auntie, a grandparent, just having that other adult figure, because the child may actually feel, well, since mom, or in some cases dad, is going through this, I don't want to burden them with my stuff because they already have their own stuff that they're dealing with. So as and that was something that occurred to me as I watched her respond to the questions that were being posed to her. So making sure that even if if she's not receptive to therapy, perhaps there's some other, maybe you have a girlfriend, auntie, grandma, whomever, that she can use for that outlet, for that sounding board, until she is ready to specifically deal with some of the things that she's seen, that she's witnessed, so that she doesn't carry something she's not emotionally equipped to carry. And when she's 16, she may be ready to leave for college soon. How is that going to impact her? Does she have any fears? So just making sure that your children have that outlet is important too. So everybody gets the help they need, and we can all go on to have a good life.
Thanks, Dr. Kinsler. And if you guys, and if you ladies think about something else as we go on, please bring it and say something. That's what they're here for. Finally, I want to introduce Bonnie and Johnny Walker. Johnny Walker. Well, what a name. Bonnie is a Navy veteran, suffering from PTSD. She has 4 children, and she's married to Johnny Walker, who's she says is wonderful. But this is unscripted, John. But you tell us. Come on, tell us. We're not going to tell anybody. Tell us the secrets. Tell us what's going on, Bonnie and Johnny Walker. And welcome.
Well, I'll introduce myself first.
Yes, please.
So Bonnie Walker, I am a survivor of a military sexual trauma back in 1994. I tried to report my assault, and I was told that I would be discharged if I had reported it. So I opted not to. And part of my coping mechanism, I got into 2 marriages. Both were emotionally and physically abusive. About 7 years ago, I got out of those relationships, met Johnny Walker, and I had kind of put I don't want to say forgotten, but kind of buried my trauma, and had a sexual encounter with my husband one morning, and all of those emotions came flooding back, as if they had just happened that next day. So, but I was really fortunate to have some individuals in my life that helped guide me into seeking the appropriate help through the VA system and have pretty much assembled a team. But since then, fast forward to now, I am the founder of the MST Survivor Project, where I locate resources across the country for survivors of military sexual trauma, and it's broken up by state for therapeutic services as well as support groups, both in the federal and the private sector. I have gone through the CPT therapy, and what's 12 sessions, it turned into a year and a half to get through the process. But I've also changed. I'm in college and I'm pursuing a master's, but I'm on my bachelor's in social work with a focus in trauma for my, to change, help advocate and keep moving forward a perspective from a survivor standpoint. But what I've recently realized is that I'm not a survivor, I'm a person, and I am capable of so much, but it's taken a lot of time and work to get there. But John's had a very interesting experience with me over the years. So,
well, since this is just between us and 2 million viewers.
Yeah, right. 2 million. 5 of my best friends are watching. That's about it.
Bonnie and I met about 7 years ago. Just a absolutely vivacious young lady that caught my eye, obviously. And I have lived in her world ever since. As she mentioned, one morning we woke up, we just kind of, do what we do in the morning, and it just came flooding back, and it completely upended everything, the preconceived notions in our relationship, because what we had founded our relationship on, and the thoughts and feelings, and the way you express your emotion towards each other, especially the emotional part and the physical part, had to be put on hold for a period of time and be completely redesigned within our relationship. As she went through, a couple bouts into the hospital with a tremendous amount of therapy and a lot of patience. Even we did therapy together, counseling together. But I never gave up on her, and there was never a reason to give up on her, because she wanted, and she was aggressively looking for, how do I make it better? And I attribute it to her. And I jokingly say I live in her world, but it is a fun world to live in, and I couldn't imagine being anywhere else. Well, Bonnie has 4 kids, I have 4 kids, and so we ended up having 8. We're like the Brady Bunch.
But he's being really kind, because I do, my emotions tend to get the best of me. I get a lot of anxiety, and there are times, even now, I feel like I'm in a really good place, but there are times in the middle of the night that I end up retreating from that relationship and have to go to another room and sleep. But it's come to a point that we're okay with that. And it's okay to feel like that, as long as I'm able to talk about it to my partner. But there's also times with my kids, he's the mediator, where he kind of has to help settle things down. And I don't want to say that I get as angry as I used to. No. But I've definitely got a fresh perspective once I finished the CPT therapy. But it's taken more than one individual to help me get there. It's just, I've had to learn to be an advocate for myself. And I've also had to learn that it's okay to say no to certain treatments. And with certain, I choose not to do my therapeutic services with the VA. I see them for medication, but I've even learned to say when on the medication, because I felt like at one point they were over medicating me because I couldn't keep up through the daily activities. So I had to learn to advocate for myself. And I think sometimes we tend to, having been in the military, we're ingrained to follow instructions. They tell you, you jump and like how high. So it's difficult when you're in the VA structure to be okay to say no in fear of like getting written up or getting in trouble.
Or saying, I'm not ready yet. I need to slow down. And that's part of the thing is Bonnie was so, I got to get through this. But it was like, hold on, girl. We got to go through this in a logical place. And when you're ready, because she would dive into it and it would make it worse because she wasn't ready for the next step or something like that. And so it's taken a lot of patience. I'll use that word generously because and then watching and understanding how her moods and how her anxiety is, because I have to be able to, if I see her getting into a situation or we're getting into a place where her anxiety is starting to do this, it's time to move into a different type of environment so that we can keep the anxiety under control.
But what he's had to learn, and this is one thing that I've been working on recently with my therapist, is, you know what, bad things are going to happen right now, and I can't retreat from them. I have to learn how to maneuver through those challenges. And so it's also trying to bring him on board because he's kind of following my lead, you know. That's what this is all about, is he's following my lead and allowing him to learn to trust that I know what's right for me. And while he's in protective mode and was for the last 3 years or more, it's still, it's a continued evolved process. It's continuing to evolve each time circumstances or things come about.
We've had therapy sessions where, because initially, you know, I had protective mode. You know, this is your wife. This is the person you love. And so, I drove her down to the West Palm VA. I got her checked in, kind of pushed her a little bit to get into the therapy and get things structured so that she could get the help she needed. She wasn't happy about that for a little while, but in retrospect, she was very grateful that we did it. But I had to learn how to stop protecting and allow her to be able to, some days it's okay not to be okay. And to be able to experience that pain and be able to, the discomfort, because that's what allows you to grow. And it was hard to do, it's hard to watch, but I don't know.
I want to get a chance to get the doctors. Dr. Kessler, what did you hear when you listened to Bonnie and Johnny talk?
I'm sorry, say that again.
So what kind of takeaway did you have listening to Bonnie and Johnny talk? Any takeaways?
I have, what I hear you saying, Bonnie, is certainly something I've heard before, because I do work with veterans privately, is that system. You're right. We are, as soldiers, trained to do what we're told. And certainly if you go to the VA, there is a very hierarchical system. And there's a little bit of fear of saying no, because, why are you saying no? You're the patient and the doctor is saying this, or the therapist is saying this. So there's almost a little bit of intimidation.
Yeah.
So being in a situation where you're empowered to make good decisions for yourself is important. And you're very fortunate to have a support system in your husband.
Yeah.
But certainly anyone else, just know that this is your life. You can make your own decisions that you're comfortable with. If you're not yet ready to move forward with this kind of treatment or this particular kind of medicine, perhaps you're concerned about it, you've read something or heard something, I don't know, you can say not now, or you can simply say no. Mm-hmm. And that's a part of the healing process, because you were in a position before where you could not say no. Or you said no and it wasn't effective. So being able to say, no, I don't want this, and have that respected and listened to is very important. It's empowering. And so if you are going somewhere, if you're getting treatment anywhere, and they're not respecting your ability, your right to advocate for yourself, to make decisions for yourself and your own treatment, I would encourage you to go somewhere else. I definitely would.
Dr. Mays, you got anything to add?
That's going to disrupt the healing process.
Okay. Dr. Mays, you have anything to add?
Yeah, I just wanted to, of course, agree with everything that Dr. Kensler said, and that's important. That empowering. You have the power, and that's what happens when we talk about MST. Is that it's the idea that I don't have the power. I was controlled by someone else, and then I blame myself. How did I let myself get? It's not your fault. It's not your fault. You didn't cause this. You didn't bring this about. It's not your fault. And so you do need to work on empowering yourself and being able to stand up and say, hey, no, I'm not taking this anymore as we go along. It's your healing. It's your treatment. It's not someone else's treatment. It's yours. And of course, having a great support system is very, 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 very important. Having a support system is key to anything that you're doing, any adventure that your children are taking on. So in this situation where you are fighting to get yourself, find out who you are, where you are, what you want to do, how you can move forward, and is that you want to be able to be empowered, and you want to have a good support system behind you. So that's what I take away from what I'm hearing from them, is that they have a great support system, and she's learning to become empowered again.
Dr. Garcia, what's your takeaway?
Honestly, I just want to commend Bonnie and Johnny on this process. I mean, what a beautiful example of what family therapy should look like. And, it's not just so taxing for the patient. It's super taxing, like we said earlier, for the family and the partner. And for Johnny to sort of give her that space when she needed it, to know when to press when she needed it. For Bonnie, for you to understand, here's this thing I'm going through, and I, even though it's tough for me, I'm understanding that it can be tough for my partner. And so let me give him a little bit more compassion, even when maybe I don't have it for myself. And really, because that happens, and to really just sort of show up for your partner in a way that, I'm just impressed by you guys. It's absolutely amazing. That's so great.
That's good. It's good to hear that. When I listened to Johnny, I was like, really, Johnny, really? But I'm just kidding. It was very interesting.
Well, I think I just wanted, the one thing that, as I've met other survivors on this journey, is that we're all in various stages, and it's good to share our stories, but it's also good to see examples of where you can get to, because we're so focused on the bad moment, but sometimes to get that hope, to build that, it's by seeing that others have done it, and it's hard. It sounds easy. No, this has been probably the hardest thing I've ever done. And I can't even express, it's tiring. I get tired of the every 2-week appointments or the once a month appointments. It's exhausting. I get tired of sharing having to repeat what happened to me over and over and over again. But there is a light at the end of the tunnel by going through this process. But to advocate for yourself, and I love my parents dearly, but I chose to not make them part of that support network because I knew that they would not be supportive of me. And that was a really hard reality for them, you know, but I specifically chose certain individuals that I felt would help me on the way. And I don't regret it one bit. And even in this process, I've had to distance myself from particular family members because it was still falling in the line of an abusive relationship and it wasn't beneficial to myself. And I needed to learn to value myself and my time because as women, you naturally want to go and help everybody else. And you forget to take care of yourself in the process. So over the last 9 months, I've been learning to take care of myself by doing the self-care and investing that time in me and putting his needs aside because he can do the dishes, he can do his own laundry, but I needed to take that time out to, even if it was going out to a dinner or go out to lunch by myself, I needed to recognize that the time that I invest into myself was important. So.
I really appreciate it, guys. We have like 5 minutes left. I want to get a chance to, first of all, Lakeidra, I know Tiffany, or you guys have any questions for the doctors? And then after that, we have a roundtable for the doctors before we can close out. Any questions from you ladies?
No, I don't have any questions because I think they kind of helped me see a lot of things. I think Bonnie has like same thing that she went through. I went through the same thing. Like I had to set boundaries. I couldn't have family around, and you know, being married twice at 30 something, like
it's hard.
It's hard.
It's hard.
I know.
Yeah. So thank you so much.
Thank you, Lakeidra. Tiffany, anything to add? Yeah. Any questions?
I don't have any questions. Hope my daughter was listening to everybody, so I appreciate it. On everything pretty much. This all is pretty hard for everybody, including me, because I'm probably the only one that's like still in intense therapy. And been in therapy for God knows how long. I think it's been over 10 years now. So I know when the doctor said earlier there's a light at the end of the tunnel, you know, you don't have to live with PTSD forever. You know, to me, it doesn't seem that way. It seems like it's just something that's just going to be there forever, you know, and I have to deal with it. I had someone last week tell me, because you know, I don't talk to anybody. I also choose not to talk to my parents about it. You know, my parents are pretty cool. They've always been around, and you know, don't really have too many complaints about them. They're just not the type of people that you would talk to about it. Just because, you know, people say things about other people with problems, and you kind of just, you're like, well, guess I won't tell you my problems.
Yeah, that's true.
It just looks like you just don't give a damn. So I'll just keep it to myself. And me, I'm probably one of the most open, caring people you'll probably ever meet. I try to instill it in my daughter, and you know, I think it's working. But she's very strong. It's hard for kids to be as strong as she is about everything. She's had reminded me of times that I've done things that I don't remember, because actually during all my suicide attempts, I black out. So I don't really recall too many of the attempts unless somebody tells me the story. But hopefully one day I will get over what it is I'm going through and learn how to cope, learn how to trust someone. You know, that I don't think that the therapy works too much. And that's just because I've seen so many therapists. I can't even keep track of them on my hands anymore. It's just how many therapists I've seen over the years. And then where I live at, I live in a rural area. It's not a lot of help that you can get out here. And hopefully one day I will be, I can still be an advocate for others, which I try to be now. But hopefully one day I can find people like the doctors that are here that will be willing to assist a lot of other people in the area that I live at. Besides me looking for help, because I believe that everybody needs to find somebody that can help them, somebody that can support them, somebody that they can trust. I'm blessed that listening to y'all say, kids need to talk to an adult, that they can trust. Pretty much this kid only talks to me. She don't talk to nobody else. So she's in the same category as me. I won't talk to nobody but the therapist. So I guess, the like mother, like daughter thing is kind of true in some aspects of it. But hopefully, like I said, I can continue to get the help that I need and continue to at least try to, make sure my daughter gets help if she ever needs it. Be there to talk to her, be a listening ear or whatnot, and just show her that, I'm strong. Like I said last week, I had somebody say, you hide behind your smile. So when I smile and when I laugh, I have a contagious laugh. If you ever hear me laugh, you're probably never going to forget it. I'm the only one with my laugh.
Okay, guys, I want to, I know we're a little bit over time, but I do want to, give you guys a chance to at least, say something real quick. I'm talking about the doctors now. And I don't know if Bonnie yet any extra, but I want to get the doctor's chance to say something before we close out on this episode. Dr. Mays, any last parting words?
Oh. You're on mute.
I just want to continue to encourage each of you all to keep working at it. And I mean, I just heard you, Tiffany, and I know it's difficult and it's challenging, but I think, just keep at it. Prayerfully, you will get a breakthrough. There is help out there, and I know it's just a challenging time right now, especially with all that's happening here. But we are three clinicians that do have a heart, who want to help, who want to be there, and so we are. So if there's anything that you can ever get with Tony, give us a call. We'll try and help you out.
Okay, and Dr. Kinsler, any past parting words?
Yeah, I would just reiterate that this is not a lifelong sentence. It doesn't have to be. It sounds like you may have to do what Bonnie did, which is leave the VA system for your therapy so that you can get some consistency. I don't know if that's the problem, but when you're dealing with trauma and you're having to rebuild a relationship from scratch, that takes time away. So it makes sense to me that you said it's been 10 years and you're still in that fight, because you're constantly rebuilding that relationship. Whereas if you could have one and then it just continue, then you can move on from there. And so I definitely applaud you for your tenacity. I applaud you for
Thanks, Dr. Kinsler. And Carlos, any last words?
Yeah, Tony, I'd like to just say something really quick on compassion. And I know that what I'm about to say is so much easier said than done, but we're all so good at giving compassion and sympathy and empathy to others, and just horrible at giving ourselves even an ounce of it. And sometimes if we can just acknowledge, like, what I tell my clients, like, right now you're just sitting in the shit. Like, life sucks, you're not happy, life is beating you up, and that's okay. And you can't cope right now. And you're a human being, and we suffer and we go through hard times. And that's not to say, there isn't a better place and there isn't a light at the end of the tunnel and all of that, but to just give yourself a little bit of compassion, a little bit of space, a little bit of time to say, you know what, life is tough right now. And I don't know that I'm winning this fight, and that's okay, but I'm going to keep fighting. I'm going to wake up tomorrow and I'm going to do it again. And that's okay. And I think, if we can just give ourselves a little bit of that, it can really go a long way.
I appreciate that, Carlos. Now I got to sit there and bleep that word out you just did and said. But before we go though, make me work. Before we go out, this is really a diverse cast because we have Army, Air Force, Marine, we're missing we're Navy down there. So it's really, this is diversity, guys. So this is what it looks like. So, okay, I want to let you guys go and I'm going to say my last little words and please stand by for a minute so we can do a quick out brief. Okay, if you don't mind, a quick debrief. Okay, thank you very much. So, I hope you guys got something out of this this particular podcast. We want to sit there and give you the families. Sometimes whenever we see something, we always see it totally geared toward the veteran and no one cares about the family. And for us, we wanted to make sure that this was something that the family can have a takeaway. I'm hoping people who watched it had something to had a takeaway on this, when it comes to PTSD, be it from MST, from other things, that there are things, there are resources out there. There are people who out there want to help you. And I think Dr. Mays already mentioned it. There's organizations like Camaraderie Foundation who at least provide some funding, if you need funding for your counseling. There are organizations out there like Cohen Veterans Network. They also provide some counseling, so that. And you have also like Dr. Kinzer and her practice, and Dr. Mays and Dr. Carlos as well. So there's help out there, but we still need more help. So I want to make sure everybody got a chance to get some insight from this. So anyway, guys, this is Veterans Counseling Veterans, our podcast of veteran suicide, the local solution. I'll see you next week. This is Tony Williams, out.